What's going on?
Hey man, how are you?
Good, good, doing well. All right, guys, let me pin this comment real quick. If you
Yeah.
didn't already know, we got Dr. Cameron Marshall here. We're going to be talking, there we go, pin the comment. We're going to be talking about all things concussion.
Yeah.
So let's start out here. And then if you guys have questions in the meantime, drop down the comments below. We had a good amount of questions prior to this Instagram live, but we'll prioritize any live questions. So let's start out with this. Cameron, why don't you introduce yourself, tell people about what it is that you do and how you got to where you are.
Okay, so my name is Cameron Marshall. I am also known as at Concussion Doc on Instagram. I am a sports chiropractor and concussion researcher, and I'm also the founder of Complete Concussion Management, which is a network of clinics throughout North America, now into Australia, as well as the UK, that specialize in the treatment and rehab of people or concussions and people with persistent concussion symptoms. And we provide training to healthcare practitioners in order to help them provide better management to patients according to the evidence-based best practice scenarios. So I think that's a pretty short little
Yeah.
bio.
Yeah. How did you get into concussion in the first place? Where did you find that niche?
Well, I just making sure I don't have feedback here. There we go.
Thumbs up if you guys can hear us, by the way. Let's see if the connection's good. We got some good information coming at you today. We don't want you to miss it.
We'll see if when I talk now, I turn my volume off, so hopefully they can hear me.
Okay,
Sorry, what was the question again?
how did you get into the niche of concussion? Like, where did this even come from, this passion of yours?
Yeah, it was so when I was doing my sports med fellowship, so it was an extra 2 years following my Doctor of Chiropractic degree, and you have to do research in a field. And I was into sports injuries, obviously, but I was looking at more sports performance. I was looking at balance rehabilitation and increasing skating speed in hockey players, Canadian and all that.
Mm-hmm.
But then one of the world famous hockey players from Canada, Sidney Crosby, ended up getting a concussion, and he was sidelined for the better part of a year. And he actually started getting treatment when I was in my residency from a chiropractor in Georgia. And so it was actually given to me as a topic for a rounds presentation. And I just kind of fell in love with the topic, because when I got into the rabbit hole of everything that was concussion, going into the pathophysiology and looking at blood flow mechanisms and all this other stuff, I kind of they just opened up this whole world for me. And that's what I decided, just to switch my entire research focus into concussion. So I've published a few studies now on concussion, and basically getting into the research world, you start to realize that what is going on from the research world and what's happening clinically is so different. And so that was where it was like, okay, we need to do something about this, because all this evidence to show us what we're doing, what effective treatments are for concussions. Most people don't even know that. Most people don't even know that there's rehab. Most people don't know that there's treatment for concussion symptoms, right? And basically the treatment is physio. It's chiro. It's well, you guys call it PT, but we call it physio. But PT, chiro, exercise therapy, vestibular, visual, education, reassurance, dietary interventions. All this stuff is all stuff that's right within our scope and right within our purview. And it just wasn't being put into practice. And basically the reason is because most people don't learn about this in school. And so that's why we developed our curriculum, to try and educate people, to bring them the evidence, to try and, be at the forefront of the cutting edge, so that people could actually get the treatment that they need. Right.
Right. No, you're 100% right. What people think is the truth is actually, it seems to be, at least for me, what I thought what a concussion was and how to manage it was a bit different than the way that you guest blogged on our website with that detailed video that you had. If you guys haven't seen that already, check out our blog. Cameron wrote a blog post for us last week. Really, really good information. And I learned a ton from what a concussion is to how to manage it. But I think let's start here. What is a concussion? And I think this is a good segue into what the biggest myth is about a concussion.
Okay. Well, a concussion is obviously a brain injury. It's in the category of what's called a traumatic brain injury, and so there's different severities of traumatic brain injury, and it ranges mild to moderate and then severe. And that's all based on things like the length of time you've lost consciousness, your Glasgow Coma Scale at the point of injury within 30 minutes after the injuries occurred, as well as the length of time you have post-traumatic amnesia. Now, concussion is in the category of mild traumatic brain injury, which means that your Glasgow Coma Scale is between 13 and 15, which a full Glasgow Coma Scale is 15. So you could have a full Glasgow Coma Scale. You have a transient onset of symptoms. So you could have headache, dizziness, nauseousness, fogginess, any number of symptoms that occur either at the point of injury or shortly thereafter, up to, 24 to 48 hours later, even in some cases where people will start to experience symptoms, a little bit of a delayed onset, but the symptoms are transient. They tend to dissipate, and there's no objective findings on imaging. So when you look at something like a moderate or severe brain injury, you'll be able to see findings on MRIs and CT scans potentially that indicate that there's been some actual structural damage. Concussion is a functional injury, so we don't have any of those structural markers of damage. And so most of the time, all the time in terms of the diagnostic criteria for a concussion, you're going to have normal imaging. Things like bleeds and things like that would escalate the diagnosis in terms of subdural hematomas and skull fractures and things like that. But in terms of the concussion injury itself, it doesn't show up on imaging. So it is a functional a functional injury that occurs outside of the presence of any imaging findings. Symptoms are transient in nature, and they tend to dissipate on their own given time. But in some cases, they obviously don't, and that's where the rehab side of things comes in. But so, I mean, loosely, it's a mild traumatic brain injury, and it's a functional injury. And I mean, it's a lot easier when I have my whiteboard and my markers to be able to draw the picture out that I do for patients, and that's actually in that blog too. So if people want to see that, that's a picture that kind of explains the whole thing. It's an energy deficit. It's a metabolic injury, as what it's called, and it also affects a whole number of different systems, from your autonomic nervous system, your cardiovascular system, blood flow mechanics, your visual system, your vestibular system, and all that stuff. So it's in the mild category of brain injury, but it actually affects a lot of different systems. And so the injury itself, a lot of people have said, well, even though it's a mild brain injury, it's actually not a mild injury at all. It's quite significant.
Yeah, can you explain that Jello analogy that you used in the video? I think that hits home with a lot of people and gives people an understanding physiologically of what it is that's really causing the concussion and what it's not, in terms of just the impact itself versus the stretching of the neurons.
Yeah, the consistency of brain tissue has been kind of equated to Jello. So if you were to take a nice big plate of Jello and have this mound of Jello, and you were to shake that plate, you would see it kind of jiggle and deform back and forth each way. But if you were to kind of zoom in on each little strand of Jello, you would see that they would stretch, right? Kind of like elastics. They would pull apart and they'd come back together, not to the point of breaking, but they would just get stretched and pulled back. And so if we consider the brain to be the same consistency of Jello, and the internal structure or strands of that Jello are actually the neurons, which are the cellular cells of our brain, those cells are getting stretched when that Jello jiggles. So when that brain gets jiggled back and forth, those cells are getting stretched. And so they used to think of concussion as being the coup contra coup injury. I know probably a lot of you guys have heard that term before, where the brain hits the skull, creating the coup, and then it bounces back and hits the back part of the inside of the skull, creating the contra coup. And it was really thought of as a bruising of the brain. So even if you go in Google right now, you'll see concussion bruise, and there'll be all these images. If you type in concussion in Google and look for images, you'll see these like concussion bruises, right? But from what we are learning now about what actually happens, or what that injury actually is, it's actually considered now to be a deeper injury. So not occurring to the outer gray matter of the brain, but actually deeper injury happening to the white matter cells and to the axons themselves. So when that stretching occurs, when the brain's jiggling back and forth after impact, that stretching actually pulls apart cells, but at the weakest point. And that weakest point is kind of those voltage gated channels. And so as soon as those cells pull apart, well, you're going to get ions wanting to exchange because of just regular concentration gradients. And so, I mean, the easiest way to think of a concussion is that the impact itself stimulates brain cells and tricks them into thinking that they've just received a signal. And so they all start to kind of fire and go. And so you have these excitation phases where it's this electrical kind of storm that kind of happens within the brain. And that's the first part. But all of that firing burns that energy. And like I was mentioning before, you have this really, really big drop in energy levels in the brain. And anyone who's been around somebody with concussion is going to see that those levels just start to drop and drop and drop. And you just want to go to sleep and you're just really tired after. And so that's kind of the explanation for that.
Yeah. And then now that you brought that up, I know previously people have thought, okay, after I got a concussion, I'm tired, I should rest, I shouldn't do anything, I should isolate myself socially, keep myself in this room, avoid interaction, avoid any physical movement. But what we're starting to see in the literature is actually the complete opposite of that. Do you want to explain a little more about what it is that actually should be done post-concussion and what it is to avoid?
Yeah, for sure. The original kind of theory or thought process behind rest makes sense, right? I just explained that concussion creates this energy deficit. So the initial thinking of professionals in the field is if we have this energy deficit, we want to be resting, because anything we're doing to burn energy, like going and exercising or continuing to play our sport and going, doing cognitive activity or anything like that we're actually burning a lot of energy within the brain, is only going to set us back. It's going to make us worse. And so for years, the theory was, don't even expose yourself to light, because even the stimulation of light hitting your retina will cause activation of your brain cells. And so they would put people in these dark rooms, and they'd completely, he called it cocoon therapy, completely isolate them from any social interaction, cell phone screens, going to school, exercise, anything like that. And they basically shut them down. And what we're starting to find out now is that actually makes people worse. Social isolation in any context is going to be detrimental for recovery. Inactivity is detrimental for any type of recovery from injury. As physical therapists and rehab professionals that, exercise is beneficial for the majority of conditions out there. It's also beneficial from a mental health standpoint. And so researchers started looking at the concept of rest and realized that it actually was detrimental for people beyond kind of 1 to 2 days. We know that acutely, if you get hit and you're on the field, if you continue to play, you will get worse. And I can go into that whole mess, but that's due to, I think, body temperature and the increased release of excitatory inflammatory markers that continue to get pushed out if you continue to exercise. But if you pull yourself out of that game initially and you maybe take 1 to 2 days of kind of taking it easy, and then you start to get back into your activity, that is the best chance you have for recovery. So it's not pulling back completely and taking a week off of school or work. It's maybe taking a day or two and then starting to see what you can do, right? If you're going to sit at home and have a headache that's a 3 out of 6, or you're going to go to work and have a headache that's a 3 out of 6, the evidence shows that you should be trying to go to school and see what you can do, provided you're not going to provoke your symptoms to a significant degree. So that is kind of, now that we're leaning towards that. And actually some of the evidence now coming about exercise, showing that exercise is actually beneficial for people in the early stages of concussion recovery, but it has to be done in the appropriate way. So I would throw the caveat in of you should be working with a healthcare professional who knows how to get you back into that exercise in the proper progression. There's treadmill tests and all sorts of other things. Actually, we covered in our course about how to do this specifically and properly. But yeah, it's a progression back in exercise. But in doing that way, it actually can speed your recovery. So think about what we've been doing for the past, 30 years. And now all of a sudden we're completely flipping that right on its head. But unfortunately, research takes, 10 years or so to make it into clinical practice. And so what you end up with now is, we have this movement going where we have like rehab professionals that are seeing concussion patients, and we're actually on the evidence-based trajectory and this cutting edge kind of stuff, getting people exercise and doing this other stuff. Yet people are still, tend to go to their GP or to the emergency department when they have a concussion. And you have these people that are 10 years behind telling people to just do nothing and rest.
Right.
And you're like, oh my God, it's just it's a constant struggle. So as much as I can educate you guys out there to just keep exercising after concussion in a graduated way and not just go into a cocoon,
Yeah.
the better off everyone will be.
Yeah, no, I mean, that's our intent with our platform as well, is to try to inform as many people as possible on what it is to and to not do. Even if it's a matter of at least figuring out where to go, that's already a big step in itself. A lot of people have these injuries. They just know theoretically or anecdotally that they should avoid anything and keep to themselves for a week and then they'll be fine. When in reality, no, you need graded exposure and you need a skilled healthcare provider to assist you with that. And with having that outside perspective with that professional, you can get back to your sport a lot sooner. And this leads me to this next topic that I wanted you to touch on, which entails that symptoms and the concussion are not correlated in a 1-to-1 ratio, meaning once the symptoms have dissipated, that doesn't mean that you're ready to return to sport necessarily, because you're still potentially at that energy deficit. And I know in that chart that you described, even though they're starting to feel better, just like other injuries too. I mean, I don't see actually I don't see any concussions in my practice, but with like post-op ACL reconstruction or maybe even a rotator cuff strain, people feel better and therefore they feel like they should get back to these higher level activities. However, in reality, they can do a lot more harm than good at that point. So if you can explain to the audience a little more about why that's the case and why you shouldn't necessarily just jump back to sport if you feel like you're ready for it, to give people a little bit of a better understanding about that.
Yeah, I mean, I think it's all the same concepts that you mentioned with other injuries, right? We typically have functional benchmarks for people to return back to sport, right? Whether it be ankle sprains, ACLs, various shoulder injuries and whatever else. We have kind of functional tests that we put people through before we allow them to go into kind of a dangerous sport, right? With concussion, however, even if you read the international consensus guidelines, these decisions tend to be made on a symptom-based approach, right? So as soon as your symptoms go away, you're supposed to do these various activities, but the problem is no one's actually doing them, right? According to the Berlin Consensus Statement, it's you rest until you're asymptomatic, or you have mild rest or moderate below symptom threshold rest, meaning you can do anything that doesn't aggravate your symptoms. Then you're getting into moderate, physical activity. Then you're getting into non-contact practices, and then you're getting into increased intensity practices with still no contact and other types of training drills such as weightlifting and whatever else. And then you get into full contact practice following your medical clearance state, and then you're in now to full, recovery. The problem is that those stages, there's 6 of them. They're supposed to be separated by 24 hours, and people will just generally look at that as a 6-day, while I'd be gone, I'm out for a week. But
Right.
they don't actually, like most physicians aren't putting people on treadmills and actually running them through the functional tests and actually checking out how they do at 2 practices non-contact and actually seeing, any functional tests. Are we measuring people's balance, reaction time, memory, concentration, vision, neurocognitive function, all these things? Are these actually being done before we're making a decision to return an athlete back to sport? In the wide majority of cases, no, that's not happening. I think it's better in the States because people they're doing baselines and they're doing post-injury tests, but for the majority, they're only doing computerized neurocognitive testing, which by itself actually has some issues with retest reliability. And so that's one tool, and I think that's a great start, but most people aren't aware that tool has reliability that with other measures like balance, like postural sway, like reaction time, like ocular motor function, saccadic visual tests, and things like that can offset any retest reliability. So you really want a comprehensive battery of protocols to be in place, but you have to do them. You can't just write them on a piece of paper and expect that they're being done, because right now, the vast majority of cases, it's, doctor says, how do you feel? Well, I feel fine now. I feel better. Okay, well then go ahead, go back to your sport, and not realizing the implications of that. Because as you mentioned, there's this energy drop, and the evidence, at least from an animal standpoint, shows that if those animals get back up to where their full energy levels are and they do suffer another concussion, they just go through that same process again. So in other words, it's just another concussion. But if they hit these animals in the middle of their recovery when they're still not back up to full energy levels, well, then they actually they get much, much, much worse, and they end up with injuries that are similar to severe brain injuries. And actually 10% of them will actually die as a result of that secondary injury. And this is called second impact syndrome. And this has happened in humans in playing high school sports across the US and a few times in Canada as well, where player gets injured with a concussion, goes back too soon, and has a fatal outcome from a subsequent hit. So the whole thing about concussion is ensuring that we're getting them back to full recovery. But like you said, the symptoms tend to go away way before the physiologic recovery actually occurs. And so what we're trying to do with all the stuff that we're doing is take an evidence-based approach and say, okay, you feel good now? That's great. Let's put you on the treadmill. Let's ramp up your heart rate, see where you're at. Okay, now they have an increase in symptoms with that. Well, obviously they weren't ready, but then we can run them through a proper protocol to get them there. And then, okay, you've passed that. Now you're going back to practice. Now you're doing this. Now at the final step, we're doing another physical exertion testing. And then we're running through a full battery of physical and cognitive tests to try and make sure that we've gotten them to a point where it's actually safe for them to return to sport. And the problem is it's not being done, as nearly as often as what it should be. And kind of that's another, mandate of what our process is try and make sure that people are safe before we send them back into sports.
Yeah, talk about risk versus reward with that. It seems to be that most injuries are kind of like that, where, for example, you have an ankle sprain. That's the highest predictor of another ankle sprain. You have a hamstring strain, same idea. And you have to be careful with how you rehab that, because how you rehab that is preventing future injuries of that same exact mechanism. And the future injury, like you said, which is 10% of animals died after that secondary concussion. So there's a huge risk there, and you got to be very careful in how you rehabilitate after.
Did you freeze?
Whoops. Yeah, I didn't know that was possible. I got a phone call while on the Instagram live. That's the first time that happened. But yeah, you got to be careful with how you rehab it, because how you rehab it is prehabbing for a future injury as such.
Yeah.
Quick question with that. What kind of neurocognitive tests were you referring to? Like what tests are you doing?
There's a whole bunch of them. There's CogSport. There's Impact is the most well-known one. There's what are some of the other ones? There's I'm drawing a blank now, but Axon Sports, what it has become CogSport, and then there's also some other kind of higher grade computer ones that are used by the military, and I'm just drawing a blank on some of the names of them right now. But there's a whole variety of different neurocognitive tests that are out there.
Okay, very cool. We had a question rolling in. Actually, this is a previous question that we had from the Instagram story I posted. And I know you mentioned this in that video too. I want to refer people back to the blog post, because the blog post really has so much information. It can probably answer almost all your questions on concussions. But the question is, can you hear me? It looks like I'm breaking up.
No, I can hear. Well, I got the headset on, so.
Okay, perfect. The question is, struggling with PCS for post-concussion syndromes for 6 months. What can I do? First, I feel like if you can explain why someone may have symptoms 6 months post-concussion, I think you kind of talked about the whole metabolic process, but why would someone even feel symptoms that much afterwards? Shouldn't they feel better at that point? And then the second question is kind of what they can do potentially and we kind of talked about what you can do with graded exposure, but I think the real cool answer would be why someone feels any type of symptoms 6 months post-concussion.
So, I mean, with acute concussion, we know about the metabolic process that happens, that energy drop. There's also other things that happen from a pathophysiological standpoint, like blood flow impairments. And when you get beyond kind of that 3 to 4 week period, which is the acute concussion, that's about the length of time it takes for that energy level to come back up. Is that anywhere between 2 to kind of 4 to 6 weeks area in there, and everyone's different, and that's what makes it a little bit more challenging. But when you get beyond that, and technically when you get beyond kind of that 4 week period is when you're into PCS or post-concussion syndrome. Well, there's a couple definitions of it, but the one we like to use is about 4 weeks. If you're still symptomatic, you're now considered PCS or post-concussion syndrome. And there's a variety of theories behind why this occurs, but we don't actually know for certain why it does occur. But the 5 kind of main theories are, number 1, blood flow. And that has to do with a few different mechanisms. There's 4 different mechanisms that can control cerebral blood flow. And really what your body and brain want to do is your brain wants to keep the blood flow consistent throughout itself. So in the event your blood pressure goes up within your body, well, your brain wants to make sure that it doesn't change within the brain, right? It wants to keep things consistent. And so it reacts to things like changes in the partial pressures of CO2 and your breathing rates and all these things. Those mechanisms are known to be impaired following concussion. And so it changes the amount of blood flow you're getting to your brain. And so one of those things that could be causing persistent symptoms is a blood flow issue, and where, you feel kind of fine at rest, but as soon as you get your heart rate up, you start to become symptomatic. Or as soon as you start doing cognitive activity, you start to become symptomatic. So that one there is something that we would test for through a treadmill test. And then the treatment for it is actually exercise. So that's treatable, but you have to do it in a sub-symptom threshold way. And the first thing you have to do is find out what your symptom threshold is. And that's where a clinician will come in and actually run you on the treadmill to try and see what your threshold target is. The next on the list of potential post-concussion syndrome creators or causes is inflammation. So neuroinflammation. After having an injury, you're going to get inflammation within the brain. And this inflammation can kind of linger and stick around. A lot of the interventions for this would either be like medication-based or also dietary interventions. So eating a low inflammatory diet, avoiding foods that are high kind of pro-inflammatory foods. Your typical gluten, dairy, sugar, refined sugar is awful. Alcohol is very pro-inflammatory. And these foods are known to actually increase gut permeability, which then can increase inflammation, which then goes to your brain. And they found cognitive deficits following, all sorts of different surgical procedures just because there's systemic inflammation. Systemic inflammation can make you feel foggy, confused, concentration difficulties, give you headaches and all that stuff. So a lot of this can be squashed by eating a really, really healthy, clean diet. And we put everybody on a low inflammatory diet following their injury. The third thing could be your visual system.
Real quick with that, what anti-inflammatory foods do you typically recommend?
It's not necessarily we recommend anti-inflammatory foods. We just avoid the inflammatory foods.
Okay.
So typically the way that we go, and there's some supplements and stuff that can help out that have anti-inflammatory properties. Things like fish oils, curcumin is a new big one. Magnesium can help with kind of that pathophysiological process in the excitatory phase. So that one has to be like a quick early one. There's all sorts of these things. Probiotics can help with gut healing and, that type of stuff. And so most of it's just avoiding the pro-inflammatory foods and just trying to eat, the clean kind of basically fruits and vegetables and high quality, meats, fish is the way to go. No, I don't want to say keto, but like, more high quality fats in your diet than, crappy carbs, but not straight keto. I wouldn't go that far. Okay, next on the list is your visual system and your vestibular system. And I put these two together because you can't really tell the difference a lot of times between them. What seems like a balance issue might be a vision issue, and what seems like a vision issue might be a balance or vestibular issue. The next one on the list, I kind of lump in with those ones as well, is the neck. So with a concussion, there's always going to be a whiplash attached to it, right? Your head and neck are connected. So any type of whipping motion of your head back and forth when you get hit is going to also create some muscular or joint damage in the neck. You may not even have neck pain. I get a lot of patients coming in. They don't have any neck pain whatsoever, yet I can reproduce their headaches just by sticking my finger in their suboccipital muscles. And it'll just be like, oh my God, right here. So anyone who's interested in this, just look at the referral patterns from neck muscles into the head. And you'll start to realize that if your headache is always, front right side, I'm going SCM, I'm going some of the joints, and I know where to look now, and I just push in there, and all of a sudden, if I can recreate that headache, I've nailed it. I know that that's where it's coming from. And now if I can loosen that off and give them some rehab exercises, I'm going to be able to get rid of that headache completely. And a lot of times, once you get rid of the headache, You get rid of the concentration problems because it's really hard to focus when you have a headache. Like all these things start to go away. My sleep gets better, and yada yada yada. But also the neck can make you feel dizzy, and it can also affect your eyes. So even as your eyes move, people will have this skipping motion, this saccadic motion of their eyes during smooth pursuits. And that could be a vision issue, that could be a vestibular issue, but that can also be a neck issue. And you'll find that if you're able to really, get in there and work this stuff out, you can get rid of all of those visual problems. And that's just a feedback mechanism through the cerebellum that you're able to actually affect change, which is crazy because you can actually affect visual reflexes just by treating the neck, which is crazy. Number 5 on that list is the psychological end of things. And so this is the one that everyone likes to hate on because, especially if you're going through it, you're like, no, it's not that. But pre-existing anxiety and depression are one of the leading causes of persistent concussion symptoms. So anyone that's an anxious person that's had anxiety in the past and they get a concussion injury, particularly with all the media coverage and hype on it, we know that is likely to lead them to having more persistent symptoms. So it's like being able to educate the patient, more thoroughly, being able to draw that picture and explain to them that, concussion is not necessarily brain damage. Concussion is a functional injury, but that's gone now. Right now we're looking at kind of some of the other stuff that could be going on. And all we have to do is run you through this stuff and figure out what it is. And once we find out what it is, it's 100% treatable, right? Mm-hmm. Concussion is a treatable thing. You just need somebody who has the knowledge to put it all together to explain to you how we're going to do it and use a systematic approach to go, okay, treadmill test, they passed. Okay, it's not blood flow. Moving on. Okay, put them on this diet. How do you feel on that? Okay, great. Are you following it? 100%. You have to be 100% on this diet. If you're going to cheat and say, well, I did a little bit of it, you're not going to get the benefit. You have to be 100% committed to your recovery. Number 3, visual vestibular, you start getting, okay, let's give you some of this. Okay, we noticed a couple issues here. Here's some rehab. Start working on that. And you're just peeling back the layers. And, eventually you're now, okay, now the symptoms are all gone, right? You've kind of pinpointed. But just getting back into that psych piece it's such a huge component of concussion recovery and no one wants to admit it. So I'm constantly referring people to therapy, talk therapy, having people go see psychiatry or even their family doctor just to look at different options for meds, anti-anxiety medication, antidepressant medication, that type of stuff. And that's often the trigger that gets people better, right? But nobody wants to go down that road, based on the stigma surrounding mental health, which is crazy. It's just, let's just get better. And that's really my whole focus. And so that's a big one. And I think that enough people aren't, too many people aren't giving that one enough credit.
Right.
So
it's tough. I mean, it's the same idea with when I try to educate my patients or clients on chronic pain or the idea of central sensitivity. And I don't always hit them with it at once. It may be a matter of when it's appropriate to find the right time to educate them on that piece, because they're here for the concussion or they're here for the back pain. However, eventually I'm going to have to, healthcare is a team and I need to get some other members of this team in to help me from their discipline. And there's a lot of secondary issues that happen with any injury. So you're telling us how there's a concussion, there's this injury that created the concussion. However, there's secondary issues that can happen because of the concussion, and now the body may try to protect itself. Muscles may try to become a little more spastic or hypertonic to try to protect the body, and now this becomes a vicious cycle, and you don't do anything, so these become more tight, and now there's got to be a point where you got to break this cycle up. And that's where a provider can help with this. So let's tell people where, let's tell people where they can go to find an appropriate healthcare provider that's skilled to treat any type of concussion.
Yeah. Well, I mean, I'm obviously biased, but our Complete Concussion Management, if you're, anywhere, at least in North America, Australia, we don't have as many right now in the rest of the world, and obviously the US we just started getting into. But if you go to completeconcussions.com/find-clinic, you'll be able to see a whole map of clinics, and it's geolocated to your area. So if you click on that, and you might be able to find a clinic in your area. If not, I mean, it's tough. There's a lot of practitioners out there that will be, let's say, like vestibular trained and will say, I treat concussions, but they're treating just the vestibular end of things. And so I think there's a lot more to concussion than just vestibular or just visual or just cognitive. Somebody mentioned here in the questions about cognitive rehab. There's a lot more to it, and I refer for cognitive rehab all the time. So I want to point that out there. But yeah, so I would start with CompleteConcussions.com. If you can't find anything in your area, then try going through family doctors and sports med and looking for PTs in your area that have training in it. There's you're kind of piecing it all together, and that was the whole genesis of our program, is to try and give people kind of a one-stop shop and give clinicians a broad overview of everything concussion related, so that they can
Sorry, you were breaking up for that last part there. Can you repeat that last? It looks like my connection is bad. I'm not sure if it's mine or not. Can you hear me okay, Cameron?
I can hear you through the computer. I don't know what's happening on the live though.
All right, there we go. All right, we're back. But yeah, so in terms of that complete concussion, let's say you're a healthcare provider and you're interested in becoming or learning a little bit more about concussion rehab and eventually becoming a provider. We've actually teamed up with Complete Concussion, where you can go on our product store and find out. There's actually a discount code that we've applied for the next 2 to 3 weeks. June 2nd, right, is when you have that code until. So if you're interested in learning more about becoming more of a concussion rehab professional, why don't you tell the audience who would be appropriate for this and what this entails?
Yeah, this course is mostly for rehab professionals. We've had a number of different disciplines take it, from nurses to doctors to sports medicine physicians, chiros, PTs, OTs. A lot of it is centered around, it's just an evidence-based course. So it walks you first through international consensus statements and different consensus guidelines. There's a section on neurology and just kind of an update on that. And then into pathophysiology, going over all the blood flow mechanisms and that type of thing, getting into biomechanics, implications for the C-spine, into our battery for baseline tests, and et cetera, into acute concussion evaluation and assessment, red flags, when to refer, then moving on into clinical management for concussion, return to learn, return to work, return to play, and then into post-concussion syndrome and what the evidence shows about that pathophysiology and what are the different mechanisms, and then getting into post-concussion syndrome treatment. And that centers a lot around rehab. That module alone is, I think, about 10 hours long. Oh, wow. So it's a big module, that covers all that stuff. And then we actually get into chronic traumatic encephalopathy and other neurodegenerative conditions with concussion, and then into kind of how to implement, this program into your practice and help it grow as a component of your practice. And so, as you mentioned, we've put up a discount for the Prehab Guys, just for that blog and everything else, and to kind of promote it. We've put up a discount on there, so you actually save $200 off our course if you go through that link. And you don't have to start the course right away, but once you do start it, you get 60 days to complete it, because we want to make sure people are moving through it. We don't want somebody to do module 1 and then come back to it in a year and completely forget everything they've done. So we have put a timeline on it to try and make sure that people are actually just getting it done. So, but even though the link expires on June 1st, you don't have to start the course on June 1st. You can start it, whenever the hell you want to. But once you do start it, then you got to be moving through it, at a decent clip. It's about 40 hours long, so it's an extensive training course. But like I said, we're trying to make people understand everything that we currently know about concussion, because we need clinicians to be experts in the area to really, because a lot of it is just education, it's reassurance, it's making sure that people are they understand what the implications are and what can be done to help it. So that's it.
That's the common theme with rehab itself, more than just concussion. But for the course, if you're not sure, check out our blog. The blog has a ton of information, and then there's also a learn more link that you can check out to get a better idea of what it is that the course has to offer. Like Cameron said, it's on our shop page right now. There's also links within our article that Cameron wrote for us last week, so check that out. And if people want to follow you, where can they see more about the content you put out?
You can follow at Complete Concussions on Instagram, at CCM Concussions on Twitter. My personal handle is at Concussion_Doc on both Twitter and Instagram. I tend to play more on Instagram. Mostly in the stories lately. I haven't put out any posts recently, but I have a couple I'm working on. So there's a really cool paper I read today that I'm going to do a post on probably tomorrow. Today. So
Awesome.
So either at Complete Concussions, at CCM Concussions, or at Concussion_Doc.
Perfect. And there's two questions that we like to ask all of our guests. Being one of the Prehab guys and trying to preach preventative medicine, what is it that prehab or prehabilitation means to you? You can take that however you want.
Yeah, I mean, I'm going to actually put it in the context of what we were talking about earlier, where it's injury, like concussion injury puts you at risk for having more injuries in the future. And it's not just concussion. Some of the studies now are finding that you're at increased risk for lower limb and upper limb injuries as well. And I think a large portion of that is given the vestibular, visual, ocular motor challenges that happen with concussion. And there's potentially subtle things that people aren't picking up. And so returning back to sport and, prehabbing other mechanisms that may not have been involved in the injury to begin with. So, looking at balance, looking at lower limb function, looking at, all these other objective signs before returning a concussed athlete back to sport, I think is a huge and kind of up and coming component of concussion recovery. And so I think that's from a concussion standpoint, that's kind of what prehab means to me.
Awesome. And then what is one piece of advice you would recommend for our audience?
Well, I mean, for the healthcare practitioners, I'd probably say, like, if you're interested in concussion, I would definitely try to be always kind of learning more about it and try to keep up to date with the evidence. There's probably about 100 or so new studies that come out just on concussion alone. It's just this explosion of research. And that's actually one of the things we do for our clinics is we have a research team that breaks all those studies down and synthesizes, and we actually put out a summary of all the new evidence every single month so that our clinicians can kind of keep up to date with it. But for the average clinician practicing, if you're going to be treating concussion patients, you're going to want to keep up to date with that stuff, and that can be a ton of work. But I would definitely encourage you to do that because it's a disservice to your patients if you're not able to give them kind of the best treatment possible for concussion injuries. And then in terms of the other people that may be out there that have concussions that are interested from a personal perspective, I would say just don't give up. Don't get negative. Don't, I know it's a long road sometimes and it's filled with ups and downs. And a lot of times patients will go through these periods where they're really kind of down and hard on themselves and believing that there really isn't any hope for them, but that's actually not the case. Keep looking, keep exploring, keep on it, and don't quit because it could be right around the corner. So I think those are the two messages that I would have for any.
I love it. Stay positive. All right. Thanks, Cameron, for hopping on. We're going to wrap this up. Any other questions? We kind of touched on most of the questions that popped in here, in addition to the questions that we previously got through direct messages and from the story. Any other questions, let us know, and maybe we'll have a round 2 discussion here. But thanks again for hopping on, Cameron.
No problem. Cheers.
All right, guys. Thanks for tuning in.